Did you know that over 30 million people in the United States alone have diabetes, and many of them experience early warning signs right in their feet? In today's video, 11 scary signs of diabetes your feet might be showing. We're diving deep into these often overlooked symptoms. Our goal is to shed light on these alarming signs, helping you identify potential diabetes-related complications before they escalate. You might be surprised to learn that something as simple as cold feet or a change in foot odor could be a critical warning. We'll explore these signs and more to provide you with essential information. Stay tuned as we unravel some of the most unexpected and scary ways your feet might be indicating a battle with diabetes. Before we jump in, I've got a small favor to ask. If you enjoy our content and want to stay updated on more health facts, go ahead and smash that like button, subscribe, and ring the notification bell. Plus, I have a little surprise for you. 3 amazing free gifts for everyone who sticks around till the end of the video. These gifts are tailored to help you better understand and manage diabetes, so be sure to watch through to get your hands on them. Now, let's dive into number 11. Focusing on swelling and redness or edema in the feet, a key symptom often associated with diabetes. This condition isn't just a mere result of fatigue or standing for extended periods. In the context of diabetes, it's indicative of a more significant underlying issue: impaired blood circulation and fluid accumulation in the lower extremities. Individuals with diabetes are particularly susceptible to these symptoms, primarily due to microvascular complications that can arise from prolonged hyperglycemia. These microvascular changes weaken the blood vessels, leading to reduced circulation efficiency and increased fluid retention in the tissues. Poor circulation and edema in the feet can lead to a cascade of complications in diabetic patients. These include an increased risk of skin infections, delayed wound healing, and the potential development of diabetic foot ulcers. In severe cases, these complications can escalate to critical conditions requiring intensive medical intervention. Therefore, when you observe persistent swelling or notable redness in your feet, it's imperative to consider these signs seriously. They serve as a critical alert from your body, potentially signaling the presence of diabetes-related vascular complications. Early detection and proactive management of diabetes are crucial in mitigating these risks. Monitoring and responding to these early signs can make a significant difference in managing the condition effectively and maintaining overall foot health. Moving on to number 10, we have persistent sores or ulcers. Now, don't overlook this. A non-healing sore or ulcer on your foot could be a glaring warning sign of diabetes. It's all about high blood sugar levels disrupting the body's natural healing process. Statistics are quite startling here. Research indicates that about 15% to 25% of individuals with diabetes will develop a foot ulcer in their lifetime. The danger: these ulcers can become gateways to serious infections. They're not just a minor inconvenience. They could lead to complications necessitating medical intervention, even amputation in severe cases. So, if you're noticing sores that just won't heal, it's not something to put on the back burner. It's a crucial cue to seek medical advice. Number 9 on our list is the numbness or tingling sensation in the feet, commonly known as pins and needles. You might brush it off as nothing serious, but in the realm of diabetes, it's a major warning sign. This feeling is a hallmark of peripheral neuropathy, a condition where elevated blood sugar levels wreak havoc on your nerves. Let's put this into perspective. Research indicates that within the first 10 years of a diabetes diagnosis, approximately 40% of patients will develop some degree of neuropathy. And it's not just a matter of discomfort. This numbness can cause a dangerous lack of sensation, making you unaware of injuries like cuts or blisters on your feet. Imagine not feeling a wound. It goes untreated, opening the door to infections and more serious complications. It's a sneaky and silent problem that can escalate quickly, turning a seemingly minor issue into a health emergency. At number 8, we delve into changes in skin color. You might think it's just a superficial matter, but for those with diabetes, it's a crucial health indicator. Skin discoloration in diabetes isn't just about aesthetics. It's a sign that could point to poor circulation or diabetic dermopathy. This condition leads to the development of light brown, scaly patches, often misidentified as mere age spots. However, These changes in skin color go beyond the surface. They can be early indicators of more serious diabetes-related complications, like atherosclerosis, a condition that impedes proper blood flow. Now, let's dive deeper. Atherosclerosis in diabetic patients can be particularly aggressive, leading to narrowed or blocked arteries. This can significantly affect circulation, not just in the feet, but throughout the body, increasing the risk of heart attacks, strokes, and peripheral vascular disease. So, a seemingly minor change in skin color could be sounding the alarm on much bigger issues lurking beneath the surface. But here's something to ponder. What if the changes in your body due to diabetes aren't just visible, but also olfactory? What if there's a sign, something you might never have associated with diabetes, that could be a critical indicator? Stay tuned as we reveal this intriguing sign further down our list. You'll be surprised to find out just how much your sense of smell could tell you about your health. Now, at number 7, we address fungal infections. You might not think of your feet as a battleground, but for those with diabetes, it's exactly that. Conditions like athlete's foot aren't just annoyances. They can be serious contenders in the fight for diabetic foot health. Elevated blood sugar creates an environment where fungi thrive, increasing the risk of infections. In fact, studies show that diabetics are more than twice as likely to develop these infections compared to those without diabetes. And it's not just the infection itself. The real danger lies in the complications that can arise, especially when the body's ability to fight off pathogens is compromised. So, if you notice any itching, burning, or unusual changes in your foot skin, don't take it lightly. It's a sign to take action. Number 6 on our list is dry, cracked skin. Sure, it seems like a common issue, but for individuals with diabetes, it's a red flag waving for attention. Those cracks and dryness, especially around the heels, are more than a nuisance, they're a health hazard. Here's something you might not know. Diabetes can cause autonomic neuropathy, affecting your body's ability to regulate moisture. This leads to decreased sweating and, consequently, dry skin. But here's the real kicker. These cracks aren't just unattractive, they're potential gateways for infections. In the diabetic foot, what starts as a small crack can rapidly develop into a serious wound, given the compromised healing ability. It's a domino effect that can spiral out of control. So, if you're dealing with persistent dry, cracked skin, don't just reach for the lotion. Reach for your phone and make a doctor's appointment. It's better to be proactive than to face the consequences later. At number 5, we're tackling cold feet. No, we're not talking about second thoughts at the altar. We're discussing a physical condition that's particularly significant for people with diabetes. Cold feet in this context signal poor circulation, often due to atherosclerosis, where blood vessels narrow and restrict blood flow. But here's an intriguing fact. The temperature of your feet can be an early indicator of cardiovascular issues, as these circulatory problems aren't limited to your feet. They're a sign of systemic issues that can affect your entire body. If your feet are often cold, it might be your body's way of waving a flag, signaling a deeper problem with your vascular health. So, the next time your toes are feeling icy, it's not just about finding thicker socks. It's a sign to listen to your body and perhaps seek medical advice. Remember, those cold feet could be telling you something much more important than just the room temperature. Stepping into number 4, let's sniff out the truth about unusual foot odor. It's easy to blame a bad smell on sweaty feet or old shoes, but with diabetes, there's often more to the story. Unusual foot odor in diabetics can be a telltale sign of an underlying infection or complication. When blood sugar levels are high, it can lead to an overgrowth of bacteria and fungi, making your feet a hot spot for unpleasant smells. But it's not just about odor. It's about what it represents. These smells can be indicators of more serious problems, like infections that could escalate quickly if left untreated. Here's a fact that might surprise you. Your foot's microbiome, the collection of microorganisms living on your skin, can change significantly with diabetes, influencing the odor. So, if you notice a sudden change in how your feet smell, it's worth paying attention. It could be your body's way of sounding the alarm. Before we unveil our top sign, the number 1 sign is something you'd probably never link to diabetes, yet it's incredibly revealing. It's often overlooked, but its presence, or rather absence, might be a subtle whisper from your body about your health. This sign might have you doing a double take at something you see every day. So, get ready for a surprise as we reveal this unexpected yet vital clue to diabetes later. At number 3, we have deformities like hammer toes or bunions. While often seen as common foot issues, in the context of diabetes, they are a signal of underlying problems. Chronic high blood sugar can lead to nerve damage and altered muscle function in the feet, resulting in these deformities. Hammer toes, where the toe joints curl downwards, and bunions, painful bumps at the base of the big toe, aren't just about discomfort or difficulty in finding shoes. They're structural changes that can affect your balance, walking, and risk of falls. Additionally, these deformities can create pressure points, leading to sores and ulcers. Did you know that diabetic foot deformities increase the risk of developing foot ulcers by up to 50%? This makes it crucial to monitor any changes in your foot's shape or structure and seek timely medical advice. Coming in at number 2 are sharp pains or cramps. If you're experiencing sudden, intense pains in your feet or legs, especially at night, don't brush it off as just a symptom of a long day. For individuals with diabetes, this can be a manifestation of diabetic neuropathy, where nerve damage caused by high blood sugar leads to pain, tingling, or cramping. These symptoms can be debilitating, affecting your sleep and quality of life. And here's a fact that's often overlooked. These pains aren't always consistent. They can come and go, sometimes feeling like a mild annoyance, other times like a severe disruption. This variability can make it challenging to recognize them as a sign of something more serious. So, if you're dealing with recurrent sharp pains or cramps, it's important to consider the possibility of neuropathy and discuss it with your healthcare provider. Get ready, because we're about to reveal the number 1 scary sign of diabetes your feet might be showing. But wait, there's more in store for you. To aid your journey towards better health, especially if you're managing diabetes, we have 3 incredible free gifts for you. First, you'll get our comprehensive ebook, 13 Foods That Lower Blood Sugar. This isn't just any list. It's a carefully curated collection of delicious, nutritious meal ideas that are perfect for keeping your blood sugar in check. Next, for the food enthusiasts among you, we're offering an exclusive recipe book filled with scrumptious, low-carb alternatives to favorites like rice, pasta, and bread. These recipes are not only tasty, but also diabetic-friendly. And for the grand finale, you'll gain access to an exclusive video, 30-second bedtime solution to stop diabetes. This groundbreaking method, supported by 2 decades of research, could be a game changer in your diabetes management plan. Make sure to watch till the end of this video to discover how to claim these invaluable resources. Finally, we've reached the top of our list. Loss of hair on the toes, feet, and lower legs. While hair loss in these areas might seem trivial or purely cosmetic, it's actually a profound indicator of vascular health, especially in diabetics. The loss of hair on the lower extremities is often a sign of poor blood circulation, a common complication in diabetes. Let's dive into why this is crucial. Good circulation is essential for transporting nutrients and oxygen to various parts of the body, including the hair follicles. In diabetes, high blood sugar levels can damage blood vessels, reducing circulation to the lower extremities. This impairs the ability of hair follicles to maintain normal growth, leading to hair loss. Here's a fascinating fact. The pattern and extent of hair loss can provide clues about the severity of your circulatory issues. Sparse or absent hair growth on the toes and feet is a clear sign that your blood vessels might be suffering from the effects of diabetes. But why should you be concerned? Poor circulation doesn't just affect hair growth. It can lead to more severe complications, like slow-healing wounds and increased risk of infections. In advanced cases, it can even result in critical conditions, such as peripheral artery disease, which significantly raises the risk of heart attack and stroke. So, if you notice a decrease in hair on your toes, feet, or lower legs, don't brush it off as a mere age-related change. It could be your body's way of alerting you to underlying circulatory issues caused by diabetes. Regular monitoring of these changes, coupled with a consultation with your healthcare provider, can be key in managing diabetes effectively and preventing further complications. Remember, every sign, no matter how small, is a piece of the puzzle in understanding and managing diabetes. Paying attention to these details can make a significant difference in your overall health and well-being. Wrapping up our journey through the 11 scary signs of diabetes your feet might be showing, we've uncovered that the true challenge lies not only in managing diabetes, but in the shadows of unawareness and neglect. These signs are more than mere symptoms. They are crucial messages from your body, urging you to take action against this silent adversary. Armed with this knowledge, you're now equipped to take proactive steps in safeguarding your health and staying one step ahead of diabetes. If you found this video enlightening and helpful, please show your support by liking and subscribing to our channel. Don't forget to hit the notification bell to stay updated on our latest content. And remember, those 3 amazing free gifts we mentioned, just head over to the description box below and grab your copies. If you want to support us further and help us continue creating valuable content like this, feel free to use the Super Thanks feature. Every bit of support helps us in our mission to educate and empower. Before you go, we have a compelling question for you. Have you or someone you know experienced any of these signs? What was the journey like towards recognizing and addressing them? Share your stories and insights in the comments below. Your experiences could be a guiding light for others navigating similar challenges. Thank you for watching, and remember, staying informed is your best defense in the fight against diabetes. Take care of your feet, and they'll take care of you.